Hey everyone, welcome back to my channel. Have you ever felt a little unsteady on your feet, like the ground beneath you is shifting? As we age, it's common to experience some changes in our balance, but did you know that there are actually a number of factors that can contribute to this? In this video, we're going to dive deep into 13 reasons why you might be losing your balance after the age of 60. We'll explore everything from inner ear issues to medication side effects, and I'll give you practical tips on how to improve your balance and stay steady on your feet. Remember, I'm here to empower you with the knowledge you need to live a healthier, happier life. So let's get started. Our bodies are amazing. They maintain balance with an intricate system, largely located in our inner ear. The vestibular system acts like an internal gyroscope. Aging can affect these delicate structures. This can lead to dizziness and vertigo. Many inner ear problems can be treated effectively. Our vision plays a crucial role in maintaining balance. Our eyes send visual cues to our brain, helping us navigate and stay upright. But as we get older, our vision naturally declines. Conditions like cataracts and glaucoma can impair our vision and affect balance. Many age-related vision changes can be corrected with glasses or surgery. Our muscles are like the scaffolding that holds our bodies upright and allows us to move with strength and stability. But as we age, we naturally lose muscle mass and strength, a process known as sarcopenia. This loss of muscle mass can make it harder to maintain our balance, especially when we're walking or standing for long periods. Weak leg muscles, in particular, can increase the risk of falls. Think of it like this. Imagine trying to stand on a wobbly surface with weak legs versus strong legs. The stronger your legs, the better you'll be able to compensate for any instability. The good news is that we can slow down muscle loss and even regain strength through regular exercise, especially strength training. Our joints are like the hinges that allow our bodies to move smoothly and effortlessly. But just like any well-used hinge, our joints can become stiff, painful, and inflamed as we age. Conditions like osteoarthritis, rheumatoid arthritis, and gout can affect our balance by limiting our range of motion, causing pain, and making it difficult to move freely. When our joints aren't functioning properly, it can throw off our balance and increase the risk of falls. I'll never forget a patient I had, a former dancer, who developed severe arthritis in her knees. The pain and stiffness made it nearly impossible for her to walk without assistance, let alone dance. While we can't always prevent joint problems, there are things we can do to manage the pain, reduce inflammation, and improve joint mobility. Medications are powerful tools that can help us manage a wide range of health conditions, but it's important to be aware that some medications can have side effects that affect our balance. Medications that can cause dizziness, lightheadedness, or drowsiness include blood pressure medications, antidepressants, antihistamines, sleeping pills, and muscle relaxants. I once treated a patient who was experiencing severe dizziness after starting a new blood pressure medication. It turned out that the medication was causing a sudden drop in blood pressure when he stood up too quickly, a condition known as orthostatic hypotension. If you're experiencing balance problems and suspect it might be related to your medications, talk to your doctor. Our blood pressure plays a vital role in delivering oxygen and nutrients to our brain and other vital organs. When our blood pressure fluctuates too much, it can disrupt this delicate balance and lead to dizziness, lightheadedness, and even fainting. Orthostatic hypotension, as we discussed earlier, is a common cause of dizziness related to blood pressure. This occurs when our blood pressure drops suddenly when we stand up from a sitting or lying position. Other factors that can contribute to blood pressure fluctuations include dehydration, heat exhaustion, and certain medical conditions. If you're prone to blood pressure fluctuations, it's important to stay hydrated, avoid sudden changes in position, and talk to your doctor about managing your blood pressure. Our nerves are like the electrical wiring of our bodies, transmitting signals between our brain and our muscles and organs. When these nerves become damaged, it can disrupt the flow of information and lead to a variety of symptoms, including balance problems. Neuropathy, or nerve damage, can be caused by a number of factors including diabetes, vitamin deficiencies, exposure to toxins, and certain medications. I once treated a patient with diabetes who developed peripheral neuropathy, which caused numbness, tingling, and pain in his feet. This loss of sensation made it difficult for him to feel the ground beneath his feet, increasing his risk of falls. Managing the underlying cause of neuropathy is crucial for preventing further nerve damage. Our brains are incredibly complex organs that play a central role in maintaining our balance. When our cognitive function declines, it can affect our ability to process information, coordinate movements, and react quickly to changes in our environment. Conditions like dementia and Alzheimer's disease can impair our balance and increase the risk of falls. Even mild cognitive impairment can make it more challenging to navigate obstacles, judge distances, and maintain our balance in unfamiliar surroundings. I remember working with an elderly patient who had begun to experience memory problems and difficulty concentrating. As her cognitive function declined, she also became increasingly unsteady on her feet and prone to falls. While we can't always prevent cognitive decline, there are things we can do to support brain health, such as staying mentally active, engaging in social activities, and eating a healthy diet. Our feet are our primary point of contact with the ground, providing stability and support as we move. When our feet hurt or aren't functioning properly, it can throw off our balance and make it painful or difficult to walk. Common foot problems that can affect balance include bunions, hammer toes, plantar fasciitis, and diabetic neuropathy. I once treated a patient who had developed a painful bunion on her big toe. The pain and deformity made it difficult for her to walk normally, and she had begun to compensate by shifting her weight to the other side of her foot, which threw off her balance. Taking care of our feet is essential for maintaining good balance. Good posture is essential for maintaining our balance and stability. When we slouch or have poor posture, it shifts our center of gravity, making us more prone to falls. Think of it like this. Imagine trying to balance a book on your head while slouching versus standing up straight. Which position do you think would be more stable? Poor posture can be caused by a number of factors, including weak core muscles, tight chest muscles, and spending long hours sitting. Improving our posture takes conscious effort and practice. Lack of physical activity. Motion is lotion. Regular physical activity is essential for maintaining our balance as we age. Exercise helps to strengthen our muscles, improve our flexibility, enhance our coordination, and boost our cardiovascular health. When we're inactive, our muscles weaken, our joints become stiff, and our balance suffers. It's like the old saying goes, use it or lose it. I once had a patient who had always been active but had become more sedentary after retiring. As his activity level declined, so did his balance. He began to experience frequent falls and became fearful of leaving his home. The good news is that it's never too late to start exercising and reaping the benefits for our balance. Chronic conditions. Navigating the challenges. Certain chronic health conditions can also contribute to balance problems. Conditions that can affect our balance include stroke, Parkinson's disease, multiple sclerosis, and inner ear disorders. These conditions can damage the parts of our brain and nervous system that control balance, leading to dizziness, vertigo, and difficulty walking. I once worked with a patient who had suffered a stroke that affected her balance and coordination. Through physical therapy and rehabilitation, she was able to regain some of her mobility and independence. Managing these chronic conditions is essential for minimizing their impact on our balance. Dehydration. The importance of staying hydrated. Staying properly hydrated is crucial for overall health, including maintaining our balance. When we're dehydrated, our blood volume decreases, which can lead to a drop in blood pressure and dizziness. Dehydration can also affect our cognitive function, making it harder to concentrate and react quickly to changes in our environment. Think of it like this. Our brains are about 80% water. When we're dehydrated, our brains don't function as efficiently, which can affect our balance and coordination. Make sure you're drinking plenty of fluids throughout the day, especially water. So there you have it, 13 reasons why you might be losing your balance after 60. Remember, balance issues are common as we age, but they're not inevitable. By understanding the underlying causes and taking proactive steps to address them, we can improve our balance, reduce our risk of falls, and maintain our independence. Thank you for joining me on this journey. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and leave a comment below, and hit the bell for more health and wellness inspiration. Until next time, stay healthy and happy.